Lupus. What is lupus? Lupus is a chronic autoimmune disease that causes a systemic inflammatory response in any organ system. Mild disease can affect skin and joints, while more severe cases can affect a number of organs such as kidneys, lungs, hearts, vascular systems, central nervous systems, joints, and the skin. There are 3 types of lupus: discoid, which is just limited to the skin; systemic, which is the most common, which can affect any organ system in the body, and it has flares up and remissions; and then drug-induced lupus, which usually occurs when taking certain medications for too long of a period of time. Alright, so when you're assessing a patient that may have lupus, patients can be seen with a variety of different symptoms. Common symptoms to assess for are a butterfly-shaped rash across the cheeks and nose, as pictured in the slide, headache, extreme fatigue, painful or swollen joints, fever, anemia, swelling, pain in the chest on deep breathing, skin rashes, and hair loss. So for some nursing diagnoses, the first example diagnosis I have is impaired skin integrity. So it would be impaired skin integrity related to exacerbation of disease process, as evidenced by itching, redness, and hair loss. A goal for this diagnosis would be the client is able to maintain optimal skin integrity, as evidenced by absence of rashes and skin lesions. And some interventions for this nursing diagnosis would be assessing for photosensitivity, as clients with lupus may have severe sensitivity to light. Also, encourage adequate nutrition and hydration to promote healthy skin and healing in the presence of wounds. Another example would be acute pain related to the swelling of joints, as evidenced by, say, guarding on motion of the affected joints. A goal for this diagnosis would be the client will implement a pain management plan that includes pharmacological and non-pharmacological measures. Some interventions for the nurse would be encouraging the use of ambulation aids when pain is related to weight bearing, and reminding the client to avoid prolonged periods of inactivity. And then for the last step of the ADPI nursing process would be evaluation. So you just want to ask yourself if the goals that we had mentioned were met. So for some medications to treat lupus, first would be antimalarials. These medications are not fast-acting, and it's important that you notify the patient not to expect results for a while. I would foresee some issues with compliance with these medications. Also, you may find that they are prescribed immunosuppressants and anticoagulants. Given blood clots can be a life-threatening symptom of lupus. Other medications would be corticosteroids and over-the-counter medications for pain, such as an NSAID or acetaminophen. So for some patient education, you want to give the patient some written resources to take home with them. When they're first diagnosed with lupus, it may be a little overwhelming to them, so make sure that they do have something to take home in the case that they do forget little details here and there. Again, inform patients that their antimalarial medications don't work right away if they're prescribed that. Educate the patient about compliance with anticoagulant medication regimens, as blood clots can occur with lupus. Some resources for patients with lupus I would refer them to www.lupus.org. I found that website had many resources for patients with lupus regarding pain management, living with the and other ways to live with the diagnosis. That concludes my presentation on lupus. I will be attaching a file from the VA also to this post that will explain more in depth on lupus if anyone's interested.